Okay. Hi, everyone. I'm Karen Sullivan. I am the Communications Director at OPRF High School. I am joined by Dr. Stephen Weber, who is the Chief Medical Officer and Vice President for Clinical Effectiveness at the University of Chicago Medicine. Dr. Weber also has been part of the medical team that's been advising the district on our hybrid learning plan. And we just wanted to go over a few questions that we think some folks in our community, our students, our faculty and staff may be having. So the first question I have is, what does the current research show about schools as a source of transmission of COVID-19?
Great, thanks, Karen. It's a critical question. I do want to add one thing about my credentials. I have a son who's a student at OPRF, and two more to follow. One more in this fall. So this has double meaning for me besides what I can offer clinically. That's the main question, right? What do we know about school transmission? And we've all been looking at everything from the scientific literature to what we see in the press, sometimes some pretty alarmist stuff over the last year. And let's face it, the circumstances have changed, and our understanding has really changed too. And we've seen almost as many approaches as there are schools and school districts around the country and around the world. I've seen the same reports you have at times, stories about schools and outbreaks and clusters. But when I sit back as an epidemiologist and infectious disease doctor and I look at the wealth of the evidence, what appears to be the case is that schools can be open safely, even in the setting of the pandemic. And so we look to places where they've put in mitigation steps, the tools and things that we know that can help prevent the spread of the virus. And we see places having successful school years. Now, that doesn't mean that there's no COVID cases in a town, a village, or a school. But what it means is a school does not need to be, and generally won't be, a place where COVID is transmitted easily between students, a concern for all of us parents, to teachers, a major and understandable concern, but even to that other concern about our schools going to become kind of the epicenter of where the virus might spread in a community. The best literature and evidence we have says that doesn't happen. And yet the other evidence, which you didn't ask about, but which we know and we hear from our pediatric colleagues particularly, is the real harm that a lot of us have seen as parents and community members of the kids not having a chance to be in school. So we balance both of those, but I have to say, I wouldn't be enthusiastic for my kids to be back in school or to advocate for the schools to open if I didn't think that the evidence said that it could be done safely.
Mm-hmm. So can you go into a little bit more detail and explain the importance of using multiple prevention strategies as OPRF is doing?
You know, I get concerned when I'm advising, whether in the hospital or different organizations and other schools I've worked with, when people talk about one thing as the solution by which to open a school safely or run a hospital or a store or an office, because it really takes layers of prevention. And some of them we're already familiar with or we've become way too familiar with over the last year. It's the idea of wearing masks when we're in proximity to one another. It's the idea of social distancing, of spreading ourselves out to reduce that risk of the virus transmitting even around a mask. And then an important layer that we don't talk a lot about is how we think about the environment around us, how we de-densify, take away some of the people who are in the space so that folks can actually spread out a little bit more. And I was grateful already to see that in the plans for OPRF from the very outset when the medical group was convened. I think the addition that's been undertaken about adding a layer of testing is another layer of security. Again, I get concerned when I hear people talking about, oh, we're going to test and so everything will be fine. Not so. Testing is another one of those layers. And testing doesn't take away the need for masks. Testing doesn't take away the need for social distancing. But what the testing does is it reduces the risk of unintentionally somebody coming into the building, coming into the school who might be carrying the virus in a way that can be easily transmitted. By keeping those folks at home, allowing them to be tested, to recover if they're sick, that's an added layer of prevention. Doesn't mean we'll catch every single person, but everything we can do to reduce that risk is an added benefit to keep our kids safer.
Mm-hmm. And why is saliva screening such a key piece of mitigation? You know, it's allowed us to look at the metrics differently and prioritize what's happening in our own school far more so now than what's happening even in the Oak Park and River Forest zip codes and the greater Cook County.
No, it's a good point. And it's a reminder that as much as we feel like nothing's changed during the pandemic and we've all been kind of cooped up and doing all this stuff, a lot's changed in our understanding of how we can detect the virus and how can we use those tests to our benefit. So the saliva testing, and it almost sounds like a gross naming to it, it's just the means by how we collect the specimen, and frankly, a better alternative to those of us who'd had swabs put up our nose and all the other testing that gets done. The saliva testing offers a number of advantages. One, it's easier to do. You don't need to deploy a nurse, a physician, a medical assistant in order to collect it because it is as simple as spitting, with some instructions, but spitting into a collection container. The other piece that it does is it allows those specimens are a little easier to handle. So I'd say they're a little more forgiving. Doesn't mean we can take them and running through hot weather, through the desert, under the water. No, but it means that actually we can collect it, group them, batch them, and then bring them for testing, unlike some of the stuff that we need to do in a hospital setting. The last piece is that the results can come back reasonably quickly. And it's quick enough not to be standing up and give us that kind of instant result, but enough so that we can act on it to take steps to prevent that person, again, from unwittingly coming in and maybe spreading the virus. None of the tests, not a single test out there is 100% perfect. We're still learning about test performance. But when you go back to what we just asked about a couple minutes ago, Karen, about those layers, it's another layer. Just like there's no perfect mask, there's no amount of distance between us that's perfect. A good test put on top of that gives that extra layer of safety. And I think as an epidemiologist, when I look at what's the information we use to make the best possible decisions, well, I've been very grateful that on the medical advisory group, and we sit with the other parents and we talk about this, that the district's adopted a position of saying, we're not looking for one magic number that's going to give us an answer. We're smarter than that. We're more reasonable than that. Yeah, we have a scorecard and a dashboard that gives information. It tells us information from around the village and around the region. And that's all important because we don't want to pretend that we're on an island. But at the same time, with the use of the test, even if it's imperfect, is going to give us really valuable, closest to home information that frankly should be weighted the most. Doesn't mean we throw away those other data and that other information, but we want it put together, not as a pass-fail, but as numbers that we can interpret and understand together, working with colleagues in public health and in the district to get to the best decision on any given time. So I really appreciate not only that that test gives a flexibility and an added layer of protection, as we've said, but it gives us another source of data and information that we can put up here and then think about to make the best decisions.
Okay. And then one final question. As you said, you have a child at OPRF. How confident do you feel that on-site learning can be safe for our students and our faculty and staff?
I'm reminded, nowadays people ask the question, what do you think of the vaccine? Do you think it's safe? I got the vaccine, so I think it's safe. I see patients, I had that offer, and on the side, I'll encourage all of you when your time comes to get the vaccine. But the same holds true. I mean, this is serious. It's no joke about our kids and their safety. If I thought this wasn't safe, I wouldn't be making this video, and I wouldn't be encouraging my son to return to school and my other kids when their time comes. The reality is, look, there's no more important thing we can do as parents. There's no more important things the district can do. And as one of the people who's helping to advise the district together with a large group of colleagues and now friends, is we want to do our best for this. And yeah, maybe we've been a little slow going. We've been a little bit deliberate, but that's fair because we want to make good decisions. We go forward with the best information that we have. So I do feel confident, but my confidence comes not only from the plan we have now, but in coming to understand that as time goes forward, we'll adapt as we need to. And if we find that with one step forward, maybe we need to take a step back, that may need to be the case. And we want to be realistic. This is for all of us. This is our first global pandemic. But at the same time, that urgency and the benefit of getting our kids back to class, back to interact with the teachers at some level is such a huge benefit and one that we all enjoy at OPRF. And I really want to see that happen. And I'm really grateful that we have a plan right now that gets us to a good start, but that can adapt as we go forward and learn as we all get smarter.
Well, those were all the questions I have. Thank you so much for your time, not just this evening, but on the medical advisory team, you and the other doctors, you've given unbelievable amounts of time, and there can't be any busier period in your lives than a global pandemic. So we really appreciate it.
For all of us, thanks very much, Karen, and thank you all for taking part in this.
Yeah, thank you.